Welcome to the SASH training on understanding and administering the Vermont Mini-Cog for SASH participants. The Vermont Mini-Cog is an assessment of cognitive decline among older adults. Cognitive decline is a major health concern. Here are some of the numbers. Alzheimer's is the 6th leading cause of death in the United States and the 5th leading cause of death for those aged 65 and older. Recent estimates show that it may actually rank 3rd behind heart disease and cancer. More than 5.8 million Americans have Alzheimer's disease today. The number of Alzheimer's cases is expected to increase to 14 million by 2050. The Alzheimer's Association projects that there is 13,000 people who live with Alzheimer's over the age of 65 in Vermont. That number is expected to rise to 17,000 in 2025, an increase of 30.8%. And 40% of those living with Alzheimer's disease are undiagnosed. Only 16% of older adults assess for cognitive issues during routine health checkups. As you can imagine from the previous screen, it is incredibly important to screen early and annually to detect and diagnose Alzheimer's and other forms of dementia. So why is it important to screen? Early detection of dementia and Alzheimer's promotes better dementia care, lowers costs of care overall, and increases the quality of life of older adults. 80% of primary care physicians in Vermont agree that there is a rationale for screening for dementia. And a diagnosis of dementia opens the door to conversations with primary care physicians. Many older adults are relieved to address their cognitive changes with their primary care physician. Early detection of dementia and Alzheimer's disease provides many benefits to older adults and our SASH participants. Early detection allows for early pharmacological interventions. It allows for the patient and family to plan for the future. They will have time to develop advance directives and other legal documents, including the power of attorney, early diagnosis opportunities for counseling for future care, and a chance to arrange financial and legal matters while decision-making capacity remains. Early detection also decreases the likelihood of complications from poor nutrition and medication noncompliance. It also delays the necessity for institutional care. And the earlier that treatment can be provided, the more can be done for symptoms. It is important for the participant to access potential treatment that could slow progress, allow time for important decisions, and end-of-life planning. And a diagnosis often brings understanding from family and friends. And overall, it could improve the person's quality of life by providing resources, services, and educational opportunities that can help maintain their independence. The majority of older adults with Alzheimer's receive care from a family member. Caregiving for a loved one with dementia can add additional stress to caregivers. They are 4 times as likely to have depression as someone not caring for a loved one. Therefore, early detection also benefits caregivers. Early diagnosis can provide families with an understanding of what is going on with their loved one, with an explanation for recent cognitive and behavioral changes. Many caregivers develop health issues related to stress and caring for another person. Early detection also provides better health outcomes for caregivers. And lastly, the earlier dementia is detected, the earlier planning can start, which can reduce the costs, monetary and personally, of caregiving. Let's delve into the components of the Vermont Mini-Cog. What is the Vermont Mini-Cog and how is it different from the more well-known Mini-Cog assessment that you may be familiar with? The Mini-Cog is a screening tool for cognitive impairment in older adults. It is brief, usually takes just a few minutes, and consists of just 2 components, a 3-item recall and a clock drawing. The Vermont Mini-Cog, on the other hand, includes all of the same, but adds one additional element, category fluency. The addition of the category fluency to the Mini-Cog adds an evaluation of verbal fluency and executive function and makes it more sensitive and specific than other cognitive assessments. It serves as a cognitive vital sign for our participants. Some of the benefits of using the Vermont Mini-Cog are there is a high specificity rate, 76%, and high sensitivity, 89%. The screen isn't affected by demographic factors. The instrument only takes about 3 minutes to administer, and it is effective in diverse populations regardless of age, socioeconomic status, or education level. The Vermont Mini-Cog is administered to SASH participants by the wellness nurse at intake into the SASH program, and at least on an annual basis going forward at the annual assessment. If at any point a wellness nurse has concerns about a SASH participant's declining cognitive abilities, they are also welcome to administer the Vermont Mini-Cog. Over time, we can provide a picture of cognitive decline or lack thereof during their time in the SASH program by looking back through old assessments and compiled data. There are 3 components to the Vermont Mini-Cog: the 3-word recall, category fluency, and the clock drawing. We're going to delve into each part of the instrument in more depth. At the start of the Vermont Mini-Cog instrument, the wellness nurse will provide the SASH participant with 3 words, stating, "I'm going to say 3 words that I want you to repeat back to me in a minute. The words are blank." The wellness nurse can choose from a variety of word choices. Some options are banana, sunrise, chair, telephone, umbrella, flowers, captain, garden, picture. Then ask the participant to repeat them back to you to make sure that they heard them. The 3 words are simple and unrelated. Make sure you make a note of what the 3 words are. They will recite them back to you after a minute.
So we are going to do what's called the Mini-Cog assessment.
Okay.
And it's 3 short questions.
Okay.
And just like how we check your blood pressure and your heart rate to see how your heart's doing, these are some short tests to see how your brain is doing today, just how it is right now.
Probably not very good. Didn't sleep that well.
Well,
But a test is a test.
a test is a test, and this will give us a baseline so that, next year if it's different, or next month if it's different, or you're feeling like you're having some memory changes, we can look back and say, do these tests again
Okay.
and see if there's any change. So the first part of the test is I'm going to tell you 3 words, and I want you to try to remember them.
Okay.
And the 3 words are telephone, umbrella, and flowers. Can you say those back to me?
Telephone, umbrella, and flowers.
Great.
The second part of the Vermont Mini-Cog is the clock drawing. The wellness nurse may say to the participant, first, draw the face of a clock and put all the numbers on it. Make it large. There is a blank page in the SASH paper assessment for participants to draw the clock, or you can provide them with a blank piece of paper. Once they have completed the clock face, then ask the participant to draw the hands. Now draw the hands, point at 20 minutes before 4 o'clock.
And so the next test is I want you to draw a picture of a clock, a face clock, with draw with just the numbers. Don't put the hands on yet.
Okay. Let's see.
It's not an artist evaluation, so it's just great. And then if you could put the hands on to show 20 minutes until 4.
Before moving on to the next part of the Vermont Mini-Cog, don't forget to ask the participant to state the 3 words you asked them to remember in the beginning. Now please tell me the 3 words I asked you to remember in the beginning. Can you recite them for me?
And do you remember those 3 words I said at the beginning?
Telephone, umbrella, and flowers.
Great.
And the third part of the Vermont Mini-Cog is the category fluency test. The test is connected to speaking and speed. The wellness nurse will ask the SASH participant to list as many animals as they can in a minute. The wellness nurse could say, "Now I'm going to ask you to list as many animals as you can in a minute. Ready? Go." The wellness nurse will time the participant and make a note of how many animals they mentioned, possibly by using hash marks. Don't count animals they mentioned twice or something that isn't an animal. And then tally up how many they mentioned in the minute.
Okay, then the last test is I'm going to time you for 1 minute, and I want you to name as many animals as you can name in a minute. And you can start whenever you're ready.
Okay. Giraffe, elephant, tiger, leopard, zebra, hippopotamus, dog, cat, chicken, cow, pig, mule, horse, donkey, robin, bluebird, oriole, okay, let's go. Where did we stop? Garter snake, rattlesnake, pigeon, blue jay. Okay.
Okay, no, that's a minute. Excellent. Okay.
Now that you have the Vermont Minicog completed, how do you score it? There is a section of the SASH paper assessment to score the Vermont Minicog. You can use this as a means for keeping track of the screening scores. You can also enter the information directly into PHL. When scoring the 3-word recall, if the participant gets all 3 words correct, they earn 3 points and pass this part of the test. If they get 2 words correct, they earn 2 points and earn a borderline score. And if they get 1 word or no words correct, they get either 1 or 0 points. When scoring the clock drawing, there are many things to take into consideration. Respondents can score a total of 7 points in this section, 1 point for everything they added correctly on the screen. When looking at the hands of the clock, check to see that 2 hands are present and the hands are in the correct position for the time. When looking at the numbers, look to see that numbers 1 through 12 are present, the numbers are in the correct order, the numbers are in the correct position, the correct hour, which is 4, is indicated, and the minute target number is also indicated. When scoring the clock drawing, there are many things to take into consideration. Using the point scoring system from the previous screen, depending upon how many points they received. If they had 5 to 7 points, they pass. If they had 4 items correct, they received a borderline score. And if they had between 0 and 3 items correct, they would fail this portion of the test. What do you look for when scoring the clock drawing? Here are some examples of what a clock drawing may look like at the passing or normal, borderline or moderate, and failing or severe categories. What might you notice about the clocks in the 3 categories? The clock in the normal category has the correct time and the numbers look like the order of a clock. In the moderate category, the moderate clock doesn't show the correct time and has the numbers off to one side. And in the severe category, the hands start from the side of the clock, the numbers are in the wrong order, and the time is incorrect. It's good to know what to look for when scoring the clocks. Now let's move on to the category fluency part of the assessment. When scoring the category fluency, if the participant names more than 15 animals, they would pass this part of the instrument. If they name just 15 animals, they would be borderline, and if they mention less than 15, they would fail this part of the assessment. What are some reasons why a participant may be unable to perform the Vermont Minicog? Participants who already have a diagnosis of dementia or other cognitive decline often cannot do these screens. Sometimes the screens invoke a lot of anxiety and make it difficult for people to perform. And some people may not be able to understand the instructions either due to dementia or a cognitive delay or developmental delay. If a participant is unable to perform any part of the assessment, there is a box for each part of the screening which will allow you to share which parts they were unable to complete. To complete the Vermont Minicog, you need to provide a total cognitive ability score. This is a culmination of their scores on all 3 parts of the Vermont Minicog. A pass means that they have received a passing score on at least 2 of the categories. Fail means that the participant received a borderline score on at least 2 of the categories or failed at least 2 of the categories. On the assessment and in PHL, you would indicate if their total cognitive ability score was a pass or fail. After completing the Vermont Mini-Cog and indicating the scores and overall cognitive ability score onto the paper assessment, the next step is to enter the information into PHL, our data management system. After creating a new visit for the participant and entering any other information relevant to this visit, you will click on the Vermont Mini-Cog tab to enter the data relevant to this assessment. The top of the tab contains the instructions, and the contents of the tab has radio buttons that correspond to the score for the 3 different parts of the training. Here you will enter the score and related information for each category of the Vermont Mini-Cog. When you're done entering the assessment, click on the Complete button at the bottom of the screen. Once you have completed the Vermont Mini-Cog and you now have a score, what do you do next? What do you do with the results, and how do you support the participant if they have borderline or failing scores? First, a failed or positive screen, which means that they failed all 3 components, 2 of the 3 components, or received a borderline score on 2 of the 3 components, does not indicate that the SASH participant has dementia or Alzheimer's disease. There could be many reasons why the participant failed the screen. The screen is not diagnostic, but more an indicator that something else may be going on. Some reasons are sleep deprivation, stroke or TIA, acute stress or grief, altered blood sugar, and medication side effects, among other things. So what is indicated by a failed screen? It means that further workup is required, and ultimately, they should be referred to their PCP or the nearest memory center for more complex issues. However, similar to an elevated blood pressure, a failed mini-cog is a symptom of something going on in their brain. It is the brain vital sign, like blood pressure and heart rate are the heart's vital signs. It is helpful to compare screens from year to year and watch for changes. So what if they pass the screen? This means that they passed all 3 components of the mini-cog, or passed 2 out of 3 components of the mini-cog. This can then serve as a baseline for future screens. In the process of conducting the screen, there are some things we suggest you don't do. Don't ask leading questions. Don't give them hints or help them pass. Don't offer categories in the category fluency portion of the screen, such as, what about zoo animals? The point of the screen is to see if the SASH participants can still access information stored in the brain by category. Either conduct the screen without family members present, or if they are present, ask them not to help or give hints. When screening a couple, do it separately, or ask for a different 3-word recall. Avoid having a clock within sight of the person who is taking the screening. We don't want to impact their assessment. Fear of Alzheimer's and dementia causes a lot of anxiety. If doing the screen causes anxiety and distress, don't do the screen. It is also best practice to not tell the SASH participant that they failed the screen. We suggest asking if it is okay to share the results with their doctor. There are many resources available for those living with dementia and their families. SASH has created a resource handout which is on STAR under memory care and also attached to this training. 3 of the largest agencies with resources, the Centers for Disease Control and Prevention, or CDC, the Alzheimer's Association of America, and the Alzheimer's Association. We encourage you to use the resources available on these sites and share information from here with SASH participants. Also check STAR for other resources under the Memory Care section under Shared Resources. SASH would also like to extend a heartfelt thank you to Dr. William Pendlebury, who created the Vermont Mini-Cog. Dr. Pendlebury is a professor emeritus of neurological sciences at UVM. He is also the medical director of the memory program and director of neuropathology at the UVM Medical Center. He is also the former director of the Center on Aging at UVM. Dr. Pendlebury provided resources, information, and support during the creation of this training. He is an invaluable member of our community, and we are grateful for his time and dedication to supporting the brain health of older adults. Thank you, Dr. Pendlebury. For additional questions about the Vermont Mini-Cog, go to STAR under SASH Tools, Nursing Tools. Thank you for joining us today.